A very good afternoon, everyone. I am Priyanjali, your host for today's live from All About Skin Wellbeing team. I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some time in their lives. Urticaria is characterized by a round rash on the skin that itch intensely. It may be due to chemical in certain food, allergy in certain medications, insect stings, sunlight, and sometimes the cause is unknown. As per study published in Indian Journal of Dermatology, venerology, and leprosy, more than one-fifth of the population suffer urticaria at one time. 60% patients are in the age group of 20 to 40 years. Incidence is higher in older age group. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self-medication can worsen its symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, and the kind of test required for its diagnosis, the right treatment and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist of India, Dr. G.S.S. Sandeep. He's a dermatologist and immunodermatologist and dermatopathologist in Narayanguda, Hyderabad, and has an experience of 11 years in this field. Dr. Sandeep G.S.S. practices at Saanvi's Skin and Health Clinic in Narayanguda, Hyderabad. He completed MBBS from Mamata Medical College, Khammam in 2008 and MD Dermatology from SVS Medical College in 2012. He has years of experience in this field, and his skill and compassion has made a tremendous difference in patients' life. A warm welcome to Dr. G.S.S. Sandeep. It's a pleasure to have you with us today as we are going to discuss about a very important topic, which is the management of urticaria. First of all, I would like to ask you, doctor, what is urticaria?
Yeah, thanks a lot, Pushpanjal, for your kind words. So simple like a terminology to it can be explained to everyone is urticaria in layman terminology. It's called allergy. Okay, allergy to something else. Okay, and symptoms wise, if you go it now, the like majority of clients complaints of itching with wheels. Okay, in their own language. Okay, some in Hindi call it the dadore. Okay, allergy to something else is urticaria.
Right. Well, doctor, quickly moving on to the next question, as we now know that it can be an allergy to something. What can be the causes of urticaria?
So, if you go with cause of urticaria, we have to classify it. One is ordinary urticaria. Ordinary urticaria means urticaria to something like food, okay, or medicines like that. Second thing is physical urticaria. What mean physical urticaria? So something touches us like heat or cold, okay. Next thing is contact urticaria. What mean contact urticaria? Something penetrates below our skin, like insect bite, stings like that. Okay. Next thing is severe form of urticaria, that is angioedema. Drugs or infections may cause severe form of allergy, that is angioedema. And like again, urticaria, which is severe related to infections, we will call it urticarial vasculitis. Okay, if you classify the like causes of urticaria, ordinary urticaria, physical urticaria, contact urticaria, and angioedema and vasculitis. And in few clients, they doesn't know the causes of urticaria also. That is called idiopathic urticaria. Okay, in idiopathic urticaria, stress, anxiety is the like a key factor. Even in idiopathic urticaria, where they doesn't know the reason, even dust also a reason. Okay.
Right. Right, doctor.
Yeah.
Well, I believe it's the entire concept of urticaria itself is very vast. So,
Yes.
for all the patients who are suffering from urticaria or who are unable to figure it out, the best possible thing you can do is visit your nearest specialist right now.
Yes.
Doctor, we
Yes.
move on. Right, doctor. We move on with the next question. The next question for you would be, how does urticaria look like? As we know, it's an allergy, but how can be the formation of it?
So in ordinary urticaria, we'll get red elevated lesions on the skin all over the body. Okay, depending upon the cause, they might be less than 1 hour, less than half day, even throughout the day. Okay, red elevated itchy lesions, wheals. Okay, it's ordinary urticaria. Again, coming to angioedema, severe form of allergy, we'll get it swelling on the face, swelling on the lips, swelling on around eyes. That is angioedema. In arterial vasculitis, we'll get red dots all over the body. Okay, that is related to blood vessels, arterial related blood vessels. Like symptoms wise, red elevated itchy lesions, wheals, swelling around face, angioedema, red flat or elevated like tiny lesions, vasculitis. They present in three forms.
Right. Doctor, well, not just speaking about urticaria, but
Hmm.
when people they usually have any sort of disease, we tend to have been a stressful situation, or
Mhm.
mostly we see people very much stressed. So speaking
Hmm.
about urticaria, how harmful can this be?
So ordinary urticaria, if we like ignore it, few clients it doesn't disturb their routine life. Okay, sleep or their routine work. Okay, it doesn't disturb. That is ordinary urticaria we sustain for less than hours. Okay, severe form of urticaria we sustain more than 7 to 12 hours now that disturb their sleep life, that disturb their work life, even their personal life that get disturbed. And coming to angioedema or arterial vasculitis, there's like emergency situations in dermatology, where if swelling occurs on face, nothing will happen. If swelling occurs in the like, respiratory tract, they may land up in anaphylactic shock or even in a, like breathing disorder that may lead to death also. So angioedema and severe form of vasculitis is a like emergency situation. Ordinary urticaria, we can manage it through simple medications or avoiding the triggers. How far it dangerous is like it's a spectrum. Ordinary spectrum, ordinary urticaria will won't hurt us. Arterial vasculitis or angioedema, definitely we have to approach a dermatologist and a proper care and emergency like a situation. It may be life threatening also in few clients, rarely.
Right.
Yeah.
Well, for all the viewers who are watching us right now, हम हमेशा एक ही बात आपसे कहते हैं कि कोई भी बीमारी हो, कोई भी समस्या हो, उससे उतना दूर तक नहीं लेके जाएं आप। आप जब इनिशियल स्टेज में हैं, तो हमारे एक्सपर्ट्स हैं आपके लिए, आपके सहायता के लिए। जब भी कोई भी चेंजेस आपके शरीर में आप देख रहे हैं, इमीडिएटली रश टू योर नियरेस्ट एक्सपर्ट। एंड आई बिलीव उतना समस्या, उतना तकलीफ आपको तब नहीं फेस करना पड़ेगा। Doctor, we quickly move on with the next question. The next
Yeah.
question for you is, what are chronic urticaria hives? How will they go away?
So chronic urticaria, that's what like a more than 6 weeks to 6 months old urticaria is called chronic urticaria. Okay. So chronic urticaria means like a idiopathic. There is no specific reason why you'll get in chronic urticaria. Most of the times it's stress or anxiety or dust related urticaria, idiopathic urticaria. So we have to identify the root cause of like a chronic urticaria by skin prick test. Okay, where they give pricks in the skin and identify the allergen. If it is dust mite, we can't remove dust mite. It's present omnipresent, means it present around us wherever you go. Okay, avoiding mattress which is more than 5 years old. Okay, avoiding old clothes, using vacuum cleaning. If you identify like dust as a trigger, okay, and using moisturizers, this will prevent chronic urticaria. And stress related, we have to identify our stress which is causing it, and again we have to go with the medications like doxepin, which also relieves urticaria and also stress. This will help in like controlling the allergy. But if it is stress is a trigger, yes, we have to address it. Okay, chronic idiopathic urticaria where you won't find any sort of help from investigations, and it's very tough to find out the reason what is causing it. It's not food related. It might be stress or dust. Avoiding the trigger, any sort of allergy, avoiding trigger is the like first like a step in treatment. Then comes the allergy control. Okay.
Right. Right, doctor. Well, I can see a few questions coming up from the viewers, but we will definitely go with the questions which we have for you.
Sure.
Doctor, our next question for you is, what are the potential complications of urticaria if left untreated?
So ordinary urticaria won't cause any sort of issues for us. Okay, by
Mhm.
taking simple antihistamines like levocetirizine, applying calamine lotion, and if food is a trigger, avoiding it won't hurt us. It won't disturb our lifestyle or work. But if this ordinary urticaria is severe, that will disturb our sleep. And if you have sleep disturbance, that will impact on our work. Okay. And like again, if you're married and continuous itching or scratching, taking medicines, the partner will get disturbed. That may lead to like social life and personal life disturbance also. So ordinary urticaria usually won't like disturb us routinely, but angioedema, vasculitis, we had to take care in a proper way. We shouldn't neglect angioedema or vasculitis. We have to identify the reason why it's causing it and address it and get rid of it. Otherwise, it's life threatening. Rarely we may land up in like a severe complication like death. Simple logic, like the seafood. Okay, seafood, prawns, and like fish may cause swelling on the face. Okay, if the swelling on the face leads to swelling in the throat, it leads to death. Okay, anaphylactic shock. Okay,
Mhm.
swelling and vasculitis, red dots all over body, swelling on lips or face, that is life threatening. That need to be like a stress and that need to be approach a doctor as an emergency step.
Right. Doctor, as you have already mentioned that for chronic urticaria, stress can be one of the main reason. Also,
Yes.
we know that a lot many diseases can be caused by stress. So, what does stress urticaria exactly look like?
So stress urticaria usually resembles ordinary urticaria. Okay, like itching all over body with elevated lesions. Okay, and in few clients they doesn't know like see any lesion, but there's itching on the all over like without any like wheals or without any red dots, but they cause itching all over the body. It may look like ordinary urticaria with red elevated lesions, or it may be looking like simple dry skin. We think itching all over body. There's no specific reason one can identify in idiopathic urticaria, chronic urticaria.
Right. I believe for all the people who are watching us right now, this can be one of the best answer for you. Doctor, we also know that urticaria has tendency to increase during the night. So, why does it normally happen?
So, like, it's not like that. Okay. Increasing the night
Hmm.
related to other source of urticaria, like cholinergic urticaria. Okay. In
Hmm.
ordinary urticaria, if you have the trigger, like if you are allergic to something else, if you have it, you may get it in few hours. Okay.
Right.
And cholinergic urticaria means, like, for example, if you are like staying in hot and humid weather, if you are putting on AC, which is less than like, around 17 or 18 degrees, cholinergic urticaria, which is like temperature related, okay, that causes itching. Even if you bathe and come out, the hot water or cold water, that triggers in the hormones in the body that causes allergy. There's nothing like that. You will get allergy more in the night time. Chronic idiopathic urticaria, which is related to stress or anxiety, once like in the job, there will be like we'll be diverted, will be like issues with like work. Once you come home, there will be nothing to do. Then the allergy starts. That is stress-related urticaria. If you ask me
Right.
specifically, stress-related urticaria we'll see more in the night time, and also like dust-related. When you sleep on the mattress which is more than 5 years old, dust contact will
Mhm.
get contact with the skin that cause itching.
Right. Right. So,
Yeah.
doctor, are we somehow saying that because our mind is conscious at the night, during the night, so maybe we realize more about, the problem?
May or may not. That's also like that limited to specific only specific part of the body. Like mind is free, relaxed. Okay, then one part of the body starts itching. That is not urticaria. That is eczema. Okay, and urticaria at night most probably are idiopathic, chronic, or it may be cholinergic. Okay,
Right.
it's in the spectrum. Only two things fit into like night urticaria.
Mm-hmm.
Hmm.
Doctor, if any occurrence or problem when arises in our body, we normally, tend to see um, the home remedies. What home remedies we can apply? So, in case of urticaria, are there any dietary precautions or any lifestyle changes we need to apply?
Yeah, definitely. In ordinary urticaria, which is less than 6 weeks old, okay, and it's related 99% to the food, okay, and urticaria due to short duration. Food, if we consider na, we like there been no, they are not rare food we used to take every day, okay. We become allergic in between, not from the like day one of the food. Okay, if
Right.
you're getting allergy, sit calmly and check yourself for past 7 to 2 hours. Okay, not a day,
Right.
not hour. Okay, like
Mhm.
animal protein, chicken, mutton, fish, prawns, egg, milk, cheese, paneer. Okay, coffee, tea. and underground vegetables, carrot, beetroot, potato, sweet potato, arams, onions, colored food, sauce, pickle, chocolates, even alcohol. Okay, nuts and a drumstick, tomato, wheat. List is like endless. Okay, but the thing now we have to calmly assess ourselves and evaluate the food which has we have taken past 3 days. Usually, Chinese food or artificial like colored flavored food is a triggers in short duration urticaria. And in drug related now, we can go back to 6 weeks of medications, not even 3 days, 6 weeks of antibiotic may cause some allergies in with few medications. So if you are like allergic to paracetamol, if you are allergic to acetophenone, write it down and show to the doctor when you visit. If you are like advising any painkillers, you'll be careful. Food related is a common food. We are taking it, we become allergic in between, not on the day one. So we should be careful. We should identify the trigger. We should avoid it. And in between, once you become normal, we can again cross check with the food item. We can have it and keeping the medicines in hand. And if you get hives or allergy, again take the tablet. Avoid that food. So short duration urticaria is food related. Home remedies like a simple applying ice. Cholinergic urticaria, if you bathe with hot water or cool water, immediately after coming out, you'll get itching all over body. Try to avoid
Mhm.
hot water bath. Try to avoid cool water bath. Okay, applying ice pack on hives will relieve these symptoms.
Right.
Okay.
Doctor, I think this is one of the most important question, and mostly people suffering with urticaria would
Yeah.
wonder this. Is it contagious anyhow?
No, urticaria is self-limiting. It's like blood pressure or diabetes. They are not contagious. No?
Right.
Okay,
Okay.
urticaria is self-limiting.
Right. Doctor, is it also true that urticaria makes us tired? It can make us tired.
Definitely. Okay, if it is related to nerves related, na, that will make us like fatigue. Okay, at the end of the day, the types of
Mhm.
urticaria in substance be released in like neurological urticaria that impact on nervous system. Okay, and chronic scratching also at the end of the day. Okay, and social stigma that also makes us tired.
Right. Doctor, can COVID cause hives somehow?
Definitely, whatever you tell in the universe, we can correlate to urticaria. Whatever you tell, even water also we can correlate. That is called aquagenic urticaria. There are a few
Right.
clients, okay, they're helpless clients usually.
Mhm.
Allergy to water. Imagine the situation. Okay, that's it. Okay.
Right. It's like imagining life without
Um,
life. Moving on to the next question, Doctor.
yes.
What lab tests are needed and why?
So usually ordinary urticaria doesn't require any investigations. Okay. Angioedema, vasculitis requires investigations. Complete blood picture, complete urine examination, ANA
Mhm.
profile. Okay, and complement C4. Okay, for vasculitis. Okay, and uh, thyroid, diabetes. Okay, and these are things which are required for further maintenance. Maintenance with the steroids or methotrexate requires further evaluation, where require RFT, renal function test, liver function test. Okay, usually ordinary urticaria they doesn't help in any sort of clues. All investigations seem to be normal.
Right.
Yeah.
Doctor, also please let us know what are the treatments available for urticaria.
So treatment, first of all, treatment is identifying the allergen. Okay,
Mhm.
that's the first line of
Okay.
treatment. Second line of treatment, symptomatic relief. Okay, like a simple, everybody knows about levocetirizine. Okay, then
Right.
simple fexofenadine. Okay, then loratadine, elaspan tablets, Allegra tablets. Okay, they relieve symptomatically, means they reduce the allergy, but they won't remove the allergy. Identify the trigger and try to address it. That is ordinary urticaria. Next thing is angioedema, where we require life-threatening. They require short course of steroid, either shots, injections, or tablets. Okay, and tapering the steroids in a proper way after further evaluation. If they are diabetic, if they are hypertensive, we should caution them. Okay, blood vessels, blood sugar levels might rise, their BP might rise. We should caution them. We should taper the steroids. Next, in chronic urticaria, we go further. We can't give steroids for long term. Where will methotrexate like a tablet, cyclosporin, they come into the picture. Then next level biologics. What are biologics? The signal blocking agents. Okay, rarely we go for biologics also, very rarely. Okay, treatment depends upon the type of urticaria and how much
Right.
troubling it and whether it's life threatening or not.
Well, that was Dr. Sandeep for us. We are extremely thankful to you, Doctor,
So,
firstly, that you could join us in such a short notice. And also, we know that we have been trying to exceed the
hmm,
time, but Doctor has a very, very important
hmm.
schedule after this. We thank you so much, Dr.
Most
G.S.S.
welcome,
Sandeep,
most
for
welcome,
your
most
valuable
welcome.
time. It has been a very informative session for all our viewers. And I'm sure all the informations will prevent our patients from getting urticaria, and in case they have such symptoms, they will be definitely working on it. That was Doctor for us. It was great to hear from you, and we look forward to many more such sessions ahead. For
Sure,
all the
ma'am. Most
viewers,
welcome,
thank
ma'am.
you for your excellent participation. Also, for more updates and to keep your skin healthy, do like, follow our FB page, all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.
Yeah, bye.